Hello everyone. I'm Dr. Shela Hirani, Associate Professor at the University of Regina, Faculty of Nursing in Canada. The title of my today's presentation is Menstrual Hygiene Challenges During Natural Disasters and Internal Displacement, a Critical Ethnography in Rural Pakistan. Disclosures. I acknowledge that there is no actual or potential conflict of interest. First of all, background. Adequate menstrual hygiene is defined as clean absorbent supplies, privacy to change and wash, water and soaps availability to wash, disposal facilities, education and awareness about menstrual hygiene practices, and dignity affirming spaces. So this is all collectively the ingredient of adequate menstrual hygiene. But the problem is that to what extent this particular definition well applies to the context of disaster. During the time of disaster and displacement, when there is a shortage of menstrual supplies and inadequate infrastructure is there, women often resort to unhygienic alternatives, which further increases the risk of reproductive infections and related morbidities and mortalities. In the context of low and middle income countries, women affected by disaster and displacement often face the add-on challenges in maintaining their menstrual hygiene practices, mainly due to non-availability of supplies and the infrastructure. Pakistan is one of the South Asian middle income and low income country that is located in South Asia, and the reproductive infections among Pakistani women during the time of disaster are reported quite high. Pakistan is one of those South Asian countries that has high mortality rates among women, especially in the rural areas where there are limited number of reproductive health services, healthcare facilities, and trained healthcare professionals. The geographic location of this country also increases the susceptibility of this region to the variety of natural disasters, including earthquake, drought, and flash flooding. The recurrent disasters are quite common in the northern mountainous region of this low middle income country, especially in the rural areas. During the time of disaster, displaced women in rural Pakistan are reported to have high prevalence of reproductive infections due to non-availability of the menstrual hygiene products and need-based reproductive services. So the overall aim of this study was to examine the menstrual hygiene challenges experienced by internally displaced women residing in the disaster relief camps of the underserved rural mountainous region of Pakistan. And the setting where data was collected was actually located in the northern region in Pakistan that is marked in red. And as you can see that the extreme northern region in Pakistan where the field work was undertaken also is sharing boundary with Afghanistan. So during the time of data collection, not only this region was facing the recurrent disaster, but it was also facing the political instability. So this is how the setting looked like during the time of natural disaster. There were flash flooding due to the glacial outburst, and the whole villages were like not no more having their residential land intact. So everybody was traveling to the top of the mountain. The roads were quite destroyed, so nobody was able to connect to the disaster affected villages via road. And even like the recurrent disaster, including the landsliding, was even making it difficult for the healthcare providers to travel to those regions. And if I say that the per day travel to those regions was around 6 hours two-way travel to and fro from the city. And there wasn't any healthcare facility available because all those were quite destroyed, and even donor agencies were hardly having the access to this region. As I mentioned that people were no more residing on their residential land because that was affected very massively by the disaster, especially the glacial lake outburst flooding ended up into the villages, into the accumulation of the debris on their residential land. So people were living at the top of the mountain and hills where they were having their tents and shelters. And these tents and shelters were not having any kind of facilities in this. It was at times like two families sharing the same shelters. There wasn't any water supply available nearby. So people were traveling to the river to be able to get water for their consumption. And during the time of flood, even at times it was too difficult because people couldn't even travel to the river at that time, because until the top of the mountain, the whole village was covered with the flood water. So the methodology that we undertook, and we used the design, critical ethnographic study design to examine the struggles, the power relationships, and conflicts in the lives of vulnerable and marginalized populations, especially women in those settings. The study was funded by IDRC, International Development Research Center, and the collaborator was the local humanitarian relief agency based in Pakistan, that is the Aga Khan Agency for Habitat, which is also the subunit of the Aga Khan Foundation. So the data was collected using the multiple methods, including the field observations, in-depth interviews, and reviews of the documents maintained by the Humanitarian Relief Agency. And the sample that included for the in-depth interviews were like 18 internally displaced women who were residing in the different villages in those mountainous, rural, disaster-affected zone. So coming to finding, the first theme from this whole study was the inadequate housing that was negatively affecting the menstrual hygiene practices of women. As I mentioned, that these tents that were temporary shelters provided to them, these were at times accumulating the families of disaster affected individuals, and each family was having around 7 to 10 members, and it was too challenging to see that women were not having any kind of water supply nearby, any washrooms were not available, there were nothing to clean themselves, there wasn't any bathing facilities available in those tents and shelters. At times, two families were asked to share this tent, and that was even difficult. These tents were not at all like weather friendly. At times it was too warm and too hot in the summer. It was at times like too cold in the winter, and the temperature was up to minus 25 and minus 15 Celsius during that time in the winter, and women were still residing in this type of housing for more than 2.5 years. So women were not having a very positive experiences. They were facing lots of challenges to maintain their personal hygiene in those tents. And one of the participants mentioned, as I quote, the tents which we were given were not that comfortable or spacious for us, as there were more people in each family, and that is why we had difficulties there. We would all go to a space in an open area and urinate there if we needed to. We didn't have anything in the tents, unquote. So here we could see that even women, whenever they had to go to the washroom, they were using the communal washrooms that at times were not like clean. They were located quite far. They were not specifically designed for women where they can clean themselves during their menstrual cycle. And even there wasn't any bathing facilities available in there. Another participant shared, as I quote, women feel very uncomfortable during menstruation, and they also have stomach aches. During the rainy days, we couldn't go to the damaged washrooms to change the menstrual clothes, unquote. So here we could see that the only washrooms available to them were their damaged washroom that were there in their residential land, that were no more maintaining the proper structure, not having a proper privacy, no doors, and women were still like had to use those type of spaces to maintain their personal hygiene or even meet their elimination needs. The second theme from this study was the inadequate infrastructure and humanitarian aid. So, in the humanitarian aid, like since they were displaced for more than 2.5 years, so the only thing that they got was the initial few first aid and the food items in the very beginning. But later, like they never receive any kind of the humanitarian aid. So, people were living from hand to mouth. They were not even having any money or any resources to even buy food for themselves. And on top of that, there wasn't any kind of the menstrual hygiene kits that were available during the time of disaster. So at times, women were so constrained that they mentioned that. Since they were not having any menstrual supplies, so at times they had to use their kids' clothing as their menstrual pads, and then later they were washing it in the river and then bringing back to their tents and shelters. And we could imagine that how difficult it would be for women and children to live in circumstances like those. Women even mentioned that and there were no like clothings available for themselves, so it was hard to maintain their personal hygiene in that scenario. One of the participants shared, as I quote, "If we recall that time, we feel like crying. At that time, the clothes that we wore were all dirty and smell. There was no place where we could wash them, and there was nowhere to go because we couldn't leave our children while they slept, as it was a deserted area," unquote. So women were not only bound because they were not having the supplies or proper humanitarian aid and no infrastructure, but also they were the one who were managing their childcare responsibilities at the same time and were facing the add-on constraints while attending to their household responsibilities and balancing it with their personal hygiene. Another theme from our study was on the no waste disposal system. So, since it was the remote area, it was a rural area, disaster affected area, so there wasn't any investment from government on the waste disposal system, even before or even during and after the disaster. So, since the disaster were recurrent and political instability was also in progress, so this was one of those areas that were not having any kind of a waste disposal system, and the ultimate sufferers were women because whatever the supplies that they had, or like if somebody, in case if they gave them the donations of menstrual hygiene supplies, it was hard for them to look after the disposal system with no privacy and with no proper disposal system. But still, like women were trying to use some of the used clothes and make use of those clothing at their level best, and later they were burying those clothes in the ground. So one of the participants, while sharing her whole experience, mentioned, as I quote, "We don't have a gutter line sewer system during menses. We looked after ourselves and threw our clothes as well, which we used. We dig up the ground and put our menstrual clothes inside the ground," unquote. So here we could learn that how add-on challenges were placing the add-on burden on the menstrual practices of women during disaster. The fourth theme from our finding was on the lack of women-friendly spaces during the time of disaster. The only space available was their tents or shelters, and many who didn't get even the shelter a tent as in humanitarian aid. So they were living homelessly, like they were sharing the spaces of other people or other families, or either they were homeless completely and living at the top of mountain. So ultimately they had no access to the women friendly spaces. And one of the participants shared the experience, as I quote, mothers who are menstruating have difficulty because they don't have a separate room where they can dry. They use clothes and wash them. There is a special place needed for this. We cannot dry them in the bathroom or anywhere outside. It becomes very difficult for us. When a woman gives birth to a child, she needs to stay in a shelter for almost a month. She also gets her period at that time. There is only one washroom which she cannot use properly because others are using that too, unquote. So here we can identify that how difficult it is in the overcrowded shelter to maintain the personal hygiene. So ultimate outcomes were the stigma, the shame, where women were fighting with all these type of stigmatization from community if they even try to share their feelings or experiences, or even they ask for help, so which was not in favor of their not only physical health but also mental, social, emotional, and spiritual health was negatively affected because of non-availability of the menstrual hygiene kits during the time of disaster. So ultimate recommendation for women that they were really wanting the bathing and washing facilities in their temporary housing. They requested for the hygiene kit as a humanitarian aid. They also recommended to have a disposal system for the used menstrual products. And also, the key recommendation was on the women friendly safe spaces where women can gather and maybe they can use that women friendly space to change their clothes, wash their clothes, and even avail some kind of a menstrual hygiene related awareness sessions or education. So, few recommendations from our end is that the humanitarian aid must target the distribution of hygiene kits and must create this separate washrooms for women, and having the disposal facilities during the time of disaster and displacement. The second recommendation is that the women must be empowered through education and must be included in the planning and execution of the emergency humanitarian aid and menstrual hygiene kits to ensure that they are need-based, context-specific, and timely during the time of disaster and displacement. And also another recommendation is that the community-based collaboration and participatory assessment and consultation with women who are accessing menstrual hygiene services are so important for the implementation of the effective and need-based menstrual hygiene services and all the interventions during the time of disaster. Another important recommendation is that there should be a comprehensive menstrual response to promote the health of women during disaster, and that must include the education, culturally appropriate spaces, menstrual hygiene supplies, toilets, bathing facilities, supplementary supplies for storing, washing, and drying, and disposing those used supplies in a proper waste management facilities. So this is one of my open access publication that I recommend to use for more information. Here are the references that I use in today's presentation. I would like to acknowledge my study participants, collaborator, and funding agency. And here are my contact details. I would be happy to take your questions. Thank you so much for your attentive listening.